Hello there. I am Dr. Zakir Hussain, Senior ENT Consultant. I am going to tell you about a condition called hairy tongue. See, the normal appearance of the tongue and the normal color. The normal appearance, it will have an appearance of a velvety coating. And the color, it ranges from dull pink to reddish in color. So when this normal appearance and the color changes into somewhat blackish and looks like as if hair has growth over the surface of the tongue. This results in a condition called hairy tongue. Why this happens? This happens because there is overgrowth of papillae, which is known as filiform papillae, on the surface of the tongue. This results in hairy tongue. So, I am sure you didn't understand. Let me explain to you. To know that in detail, you have to know the structure of the tongue. So you know that tongue helps in digestion, and most important for that, you need taste buds. So if you see this diagram, you have four types of papillae: filiform papillae, fungiform papillae, valate papillae, foliate papillae. These papillae are there in the concerned areas. So the taste buds are related to these three: fungiform, valate and foliate papillae. So filiform papillae, it doesn't have any taste buds. And filiform papillae, it occupies the majority of tongue in this surface of the tongue. And the appearance, it looks like spikes. And the length, average length is about 1 millimeter. This is how the filiform papillae looks like. It doesn't have any taste buds. And every 2 weeks, it is shed off and you get a new layer. The main function being increase the surface area. When this filiform papillae increases in length, normal length I have mentioned it is 1 millimeter. When this increases in length, this results in a condition called hairy tongue. So now you understand that hairy tongue means is an overgrowth of filiform papillae on the surface of the tongue, and it gives the appearance of growth of hair there. Now, why does this happen? So, what are the offending factors? This is how the tongue looks like. The normal offending factor, what happens is you have a bacterial overgrowth in the filiform papillae, the area of the growth of the filiform papillae. This results because of the following causes. One being overuse of medications like chlorhexidine. As you know, chlorhexidine is most commonly seen in mouthwash. And those who smoke, excess smoking, poor oral hygiene, in debilitated patients, those who are undergoing radiotherapy, those persons who drink excess of coffee or tea, and excess of antibiotic usage. So these are the common offending agents which can lead to formation of hairy tongue. So what happens when you have these offending agents? The normal filiform papillae, which ranges about 1 millimeter, it grows 10 to 15 times. And this results in accumulation of chromogenic bacteria. This bacteria gives the discoloration of that particular area, resulting in hairy tongue. So what will be the complaint of the patient? Most of the patients, they come to us by seeing the appearance of the tongue. They want to know what is happening. Is this related to something dangerous? That's what they want to know. So when I ask them, do you have any complaint? They said, no, this is mainly the appearance. Is it dangerous? Few patients may complain of tongue irritation or burning sensation when they take food. Now, the tongue appearance, it looks like this. Do we need any specific investigations for that? The answer is no. So the treatment, you should know that it's a temporary condition and it is harmless. We don't need any specific treatment for this unless this troubles you. So main thing to be taken care of is we have to stop the offending agents. Like you have to stop smoking, stop taking excess of antibiotic, stop taking this repeatedly over usage of chlorhexidine mouthwash, and what the other offending agents which I have already mentioned to you before. And along with that, you have to keep your tongue clean. You have to use tongue scrapers at least 2 times a day. And even saline wash, oral wash will be good. Suppose the patient complains of irritation or burning sensation, we can give a trial run of tretinoin local application. And if it is still persistent, we can make that particular area smooth by removing the excess growth with the help of laser. And most important is that we will advise the patient to take excess water, like minimum of 2 to 3 liters per day. This is how we manage hairy tongue. Thank you so much.